the best of the week on Relevant Radio.
I did want to touch for a moment on living organ donation. You may have heard in the news recently in Kentucky, there has been a lot of scrutiny regarding living organ donation. In other words, removing vital organs from human beings who need them in order to continue to live. This is really important, especially as Catholics. We've talked about this recently. Sister Dee Dee Burns recently joined us. I'll have to link to that episode because we talked about some of the concerns surrounding organ donation, among others, and resuscitation. How what's happening right now is there's a lack of respect for things such as what is considered brain dead, what is considered truly deceased, and how currently, the definition legally, what the hospital should be practicing, is not what is the custom within the medical field today. And you're hearing whisperings about this all the time. Every time I discuss it, someone contacts me or many people sharing, yes, my nephew, this happened. And they were quick to proclaim him brain dead when he was in the coma. And we think that they were harvesting his organs and he didn't quite meet the criteria. So here's what happened. The federal government began proceedings on August 5th, this past week, to decertify one organ procurement organization called Network for Hope in Kentucky. Health and Human Services reviewed 351 cases from Network of Hope between 2021 and 2024, in which donations had been authorized but not completed. So it just was reviewing some of them. Now, there was a concern. People were reporting on them. Here's what happened. In those cases where the organ donations were not completed, it identified 103 concerning cases, of which included 73 patients in particular displaying neurological signs considered incompatible with proceeding with organ donation. In other words, they were still living. They did not meet the criteria for brain death or whatever they were trying to do in order to say, hey, we can legally harvest this person's organs. Among those 73, regulators said more patients might not have been dead when procurement activities were initiated. In other words, those patients were not deceased, most likely in these 73 cases, when the organs were being harvested. Now, you may remember back in 2021, there was a case of Anthony T.J. Hoover, who was 33 years old at the time. It made national television a couple of years later. While they were preparing for the donation of some of his vital organs, he started moving, showing other signs of consciousness. The proposed organ recovery surgery was stopped and he actually survived. He was 33 years old. But this isn't always the case. You see, in this specific circumstance with Health and Human Services shutting down Network for Hope in Kentucky, in which they see that proceedings were occurring when there were actually vital signs showing that the people were alive when they were starting to harvest these organs. This is pointing to what has been happening with concern over why is it that suddenly organs are becoming available, multiple hearts available, when it used to be there used to be this long waiting list. They start calculating it out, how much a hospital gains from the various organs that they're harvesting. It brings back to mind, through the story of Network for Hope, how it's one example of what has been a growing whisper concerning illegal living organ harvesting. This culture of waste, as Pope Francis spoke of, with regard to not just the things we use, but people as well. And why we need to be paying close attention right now in the medical community as there are ongoing disputes over true clarification of what is considered brain dead and how what the legal definition is needs to match what the practice is in the hospitals. Especially as we're seeing more and more young people who are quickly being declared as brain dead or comatose, and questions need to be asked truly about the value a hospital can place on individual organs versus the reality that maybe there is a chance of recovery. And actually following sound teachings of the Catholic Church on medical choices, on what determines living, what is actually allowed, and what is actually necessary when it comes to medical treatment as well. We're going to link to an episode where we start to talk about what are ordinary and extraordinary means to try and keep a person's body alive, to try and seek survival. I think there's much to be said and garnered, again, from the wisdom of the church, especially as startling stories such as Network for Hope and them being shut down in Kentucky bring to mind the reality of medical choices and the reality of honoring the human person, honoring suffering and the body and natural death when it does indeed occur.
That was the Best of the Week on Relevant Radio. The best way to listen to the Best of the Week is on the Relevant Radio app, free and always free. Download and share the #1 free Catholic app today in the App Store.